is in terms of treatment and how you evaluate. There's very limited options for treatment, so we are stuck evaluating. The most common time period to look for IVH is in that first 3 days of life in premature babies, particularly under 28 weeks. So this is a typical standard policy in all NICUs around the world, that you're doing a head ultrasound, something that's non-invasive, very simple to do at the bedside, thereby not adding more stress to these premature baby, to look for that intraventricular hemorrhage, particularly in babies that were born under a lot of stress, again, putting them at higher risk of having intraventricular hemorrhage. If you do see an intraventricular hemorrhage, particularly a 2 or higher, strongly recommend getting another follow-up head ultrasound very soon after to see if there is progression of that bleeding. Again, depending on how medically unstable the patient is, that may increase their risk of having progression of that initial finding that you might find in that first 3 days of life, and that it can progress from something that's mild to actually being something that's more moderate or severe, and therefore having clinically significant impact in their brain function later in life. Treatment is typically discussed in relation to if you develop the complication of hydrocephalus. This is something that can be very frustrating for even healthcare providers because we are limited in our ability to treat the hydrocephalus because of the size and age group that this happens. So again, this is more likely to happen in the early premature infant, where they're only about this big, and so then their head is about this small. Try finding a tubing that is small enough that can be effective in draining, and the same blood that can clog up the plumbing system of the brain can also clog up the tubing that we would attempt to provide. So we can't put in anything permanent under typically 2 kilograms, and therefore unfortunately, despite the advancements of medicine in other areas, this is one area that we have not progressed tremendously. We are stuck watching the progression of the complication of hydrocephalus after IVH. Hopefully, this is something with technology and renewed interest in trying to reevaluate what we can provide, not just in monitoring, but also in treating IVH, that this is something that we can change in the coming future.